Hi, I'm Marcus. Today we will be talking about atrial fibrillation. We will go over topics that cover what it is, the symptoms, causes, risks, complications, and preventative methods. Let's start with what atrial fibrillation, or AFib, is. AFib is an irregular and often very rapid heart rhythm. An irregular heart rhythm is called an arrhythmia. AFib can lead to blood clots in the heart. The condition also increases the risk of stroke, heart failure, and other heart-related complications. During atrial fibrillation, the heart's upper chambers, called the atria, beat chaotically and irregularly. They beat out of sync with the lower heart chambers, called the ventricles. For many people, AFib may have no symptoms, but AFib may cause a fast, pounding heartbeat, shortness of breath, or lightheadedness. Episodes of atrial fibrillation may come and go, or they may be persistent. AFib itself usually isn't life-threatening, but it's a serious medical condition that needs proper treatment to prevent stroke. Treatment for atrial fibrillation may include medicines, therapy to shock the heart back to a regular rhythm, and procedures to block faulty heart signals. A person with atrial fibrillation also may have a related heart rhythm problem called atrial flutter. The treatments for AFib and atrial flutter are similar. Symptoms of AFib may include feelings of a fast, fluttering, or pounding heartbeat, called palpitations, chest pain, dizziness, fatigue, lightheadedness, reduced ability to exercise, shortness of breath, weakness. Some people with atrial fibrillation, AFib, don't notice any symptoms. Atrial fibrillation may be occasional, also called paroxysmal atrial fibrillation. AFib symptoms come and go. The symptoms usually last for a few minutes to hours. Some people have symptoms for as long as a week. The episodes can happen repeatedly. Symptoms might go away on their own. Some people with occasional AFib need treatment. Persistent. The irregular heartbeat is constant. The heart rhythm does not reset on its own. If symptoms occur, medical treatment is needed to correct the heart rhythm. Long-standing persistent. This type of AFib is constant and lasts longer than 12 months. Medicines or a procedure are needed to correct the irregular heartbeat. And permanent. In this type of atrial fibrillation, the irregular heart rhythm can't be reset. Medicines are needed to control the heart rate and to prevent blood clots. Next, let's cover the causes of atrial fibrillation. Problems with the heart structure are the most common cause of atrial fibrillation. Heart diseases and health problems that can cause AFib include a heart problem you're born with, called a congenital heart defect, a problem with the heart's natural pacemaker, called sick sinus syndrome, a sleep disorder called obstructive sleep apnea, heart attack, heart valve disease, high blood pressure, lung diseases, including pneumonia, narrowed or blocked arteries called coronary artery disease, thyroid disease such as an overactive thyroid, infections from viruses. Heart surgery or stress due to surgery or sickness may also cause AFib. Some people who have atrial fibrillation have no known heart disease or heart damage. Now let's take a look at some of the complications atrial fibrillation can cause. Blood clots are a dangerous complication of atrial fibrillation. Blood clots can lead to stroke. The risk of stroke from AFib increases as you grow older. Other health conditions also may increase the risk of a stroke due to AFib. These conditions include high blood pressure, diabetes, heart failure, and some types of heart valve disease. Blood thinners are commonly prescribed to prevent blood clots and strokes in people with atrial fibrillation. Next, let's cover some preventative measures you can take to reduce the risk of atrial fibrillation. Healthy lifestyle choices can reduce the risk of heart disease and may prevent atrial fibrillation, AFib. Here are some basic heart-healthy tips. Control high blood pressure, high cholesterol and diabetes. Don't smoke or use tobacco. Eat a diet that's low in salt and saturated fat. Exercise at least 30 minutes a day on most days of the week unless your healthcare team says not to. Get good sleep. Adults should aim for 7 to 9 hours daily. Maintain a healthy weight, and reduce and manage stress. Last, it's important to know when to see a doctor. If you have symptoms of atrial fibrillation, make an appointment for a health checkup. You may be referred to a doctor trained in heart diseases, called a cardiologist. If you have chest pain, seek immediate medical help. Chest pain could mean that you're having a heart attack.